Evaluation on Explorers. Starting with the 3CH on tooth number 28.
I'm at facial position, so I'd have to be at 8 o'clock position for 28. My patient's chin is down and slightly away from me, and maybe down just a little more. My equipment is lights overhead and 90 degrees and bright, and my bracket table is close to me. And I'm going to find the right end first, so I'm going to approach the tooth, and I'm going to first use my non-dominant hand to retract and turn it around to see the distal. I'm going to take the end of my instrument and get a nice tall fulcrum using a C shape and trying to be on tooth number 28 to find the correct end. And in the case of number 28 for a right-handed operator, I'm seeing that the number C end on the CH part of 3 is the end that wraps mesially. So I'd find the right end and call out to the teacher, it's the C end. And then I would start on the distal approach, a little mesial to the distal line angle. And then I'm going to start my technique while Mrs. Singley is reading the steps.
Held the Explorer with a light modified pin grasp. Maintain an appropriate fulcrum on occlusal or incisal surface, same arch, close to working area with light pressure. Position the terminal shank parallel to the long axis of the tooth. For distal surfaces in the posterior sextans, inserted tip just mesial to distal line angle and proceeded to distal interproximal. Reinserted for mesial surfaces in the posterior sextans. Inserted tip just distal to distal line angle and proceeded to mesial interproximal.
Watch how I'm going with my grasp staying together. I'm using my hand as a unit, making light little small zigzag strokes, going sub, pivoting on my fulcrum to keep my fingers together, rolling slightly, and this is probably a key step right here, is going under the papilla, and then I'm staying all the way under and exploring interproximal areas over halfway from the facial side, and then I'll catch it from the lingual side to do the other approach.
She's using the correct end of the Explorer, adapting the working third or tip,
And if you could
which is
turn
about 1
toward
to 2
me,
millimeters of the
chin
tip
down.
on the tooth. Walk the side of the tip along the junctional epithelium, extending strokes at least halfway across the interproximal. The strokes do not drag, they are short, vertical, or oblique overlapping working strokes. Use correct wrist action and roll the handle in the fingers to keep the tip adapted to the tooth surface.
When I move to the lingual surface, I would have to readjust and do 3 different things also. On a posterior tooth, I would automatically tell myself to go into the far position, which is 11 o'clock. My patient's chin was already down, but now instead of being away from me, it's slightly toward me and down just a little more. And I would also have to change ends. So I usually tell the students on a posterior tooth, when you're going from facial to lingual, think of 3 things that have to change: me, my patient, and my end. So if I had adjusted my light and forgot what end wrapped, I should check my end again, and I'll call out to the teacher. Looking at the ends, I use my C on the facial, so I should look at my end, and I should technically be using more toward the H end for the lingual. And it also, you can tell by looking in the camera that this is the mesial wrap, and I'm checking it by getting a close fulcrum, the right grasp, and holding it up to the tooth in the contact to see that that end wraps. And then I'm starting on the distal line angle, a little mesial to the distal line angle, small strokes, adapting the tip, going far enough interproximal, light strokes, going underneath, finding if there's any calculus or not, and their tooth feels smooth, backing out, turning it around. Get ready zone is slightly distal to the distal line angle. And again, adapting the tip, rolling as I go, but also pivoting as I go, coming all the way around, staying in the interproximal. You can see the terminal shank is parallel. 1, 2, 3, 4. Just feeling to make sure I feel enough of the smooth root surface and crown of the tooth. And coming back out.
Explore number 11, 12 on tooth number 9.
On tooth number 9, I should say first that I need to start on the distal surface. So if I was looking at tooth number 9, the distal surface for a right-hand operator would be a far surface, and that would be my noon position. It would be the near surface for a left-hand operator, and they would be at operating position number 4. So on the noon position, I have to find the right end. So what I want to do is, some students hold it up and look at it next to the tooth, but you want to get a nice fulcrum and look at if the end would be the 11 end or if the end would be the 12 end. And the 12 end is the end that wraps around the tooth. So I would say, me, I'm at noon, my patient's chin is up, it's in the center, my light is at 45 degrees, my bracket table is close by. I can retract facially first. My non-dominant hand has her lip retracted and stable. My dominant hand has a C shape. I've got the number 12 end. Before I start, I'm going to land a little mesial to the midline of the tooth. Adapt just the 1 millimeter of the tip, not the point. And then I'm going to start my sub-strokes, which blanches the tissue just a little bit as I go. I'm keeping my hand as a unit. My wrist is straight and neutral. I'm rolling, rocking, pivoting, going around the tooth. And as I'm going sub, little tiny strokes, I'm curving sooner than I need to, going all the way up. And then as I explore, you can see that the explorer should look like this at the end on an anterior tooth. The terminal shank is slightly across with the angle of the tooth showing as I'm exploring underneath the contact. The explorer shouldn't start off by starting the technique and going sideways, so when you end, the terminal shank shouldn't be this far across the tooth. That's hugging the tooth and it's too closed. It should be tall so it pivots and slightly the corner shows. It should never be parallel to the tooth like this, because that would deflect the tissue, and that would be the incorrect end to use. If I was using this end, it would look parallel at the end, and that would not be the end that wraps. So the right end does two things. It wraps around the distal surface, and I can also tell it's the right curve because I should see just the corner of the incisal edge as I finish the stroke. That's the right edge. Then I take it out, and I need to get my mirror because I want to stay in this position to do my distal lingual. Patient stays in the same position, I stay in the same position. I just need to use indirect vision. And the mirror seems to be a little dirty. Make sure the mirror is clear on all your teeth, even if it takes time to do it. Proper mirror and good lighting helps. So I'm going to get a nice fulcrum with my mirror rest to do number 9, distal lingual. My rest would be on tooth number 6. I'm going to, again, if I was using, I had called out earlier that my 12 end was the facial, so the 12 end can't be the same end on the lingual. I have to switch ends to the 11 end, make sure it wraps, and it does. Start a little bit mesial to the midline, go sub, and go all the way around the corner. Again, checking to see that I'm going far enough in, and also that my grasp is staying together. So I'm kind of looking at, is my angle slightly across the tooth? Am I far enough underneath? And is my fingers all staying together as I roll and rock and pivot? And my wrist is still neutral.